welcome to Medical Associates Health Check. I'm Dr. Laisha Salvaraja. I'm the Clinical Administrator for Medical Associates Hospital and the Head of Accident and Emergency. Today we have an exciting topic for you, one that's close to home for many people, and it's strokes. Unfortunately, today Dr. Christopher Bristow couldn't join us. He had an emergency with some plumbing, which is interesting because we're going to talk about strokes. You'll see later why plumbing is important. However, I do have two amazing doctors, Professor Vijay Narayan Singh and Dr. Avidesh Pandey, both leading experts in their fields. So let me first introduce you to Dr. Avidesh Pandey.
Thank you for having me, Laisha.
Thank you for being here. Could you let everyone know a little bit about yourself?
I am a neurologist. I've been in clinical practice for just over 10 years as a neurologist, and in terms of general practice, 17 years. And it's an absolute pleasure to be working in Trinidad and Tobago, having completed my postgraduate training in Canada, and be amongst our local colleagues and citizens.
Wonderful. And also with us today is Professor Vijay Narayan Singh, consultant surgeon, general surgeon, vascular surgeon. I think he operates on pretty much anything and everything. Prof, thank you for coming.
Delighted to be here, Laisha.
Could you tell our audience a little bit about yourself?
Do general and vascular surgery. And I think I'm here today because I do stroke surgery.
Yeah.
But I do, as you pointed out, a wide range of surgery. And I've been a surgeon for 46 years and a general doctor for 50 years.
So we have experts in the house today, so I'm very, very happy. So Dr. Pandey, let's start by talking about strokes. What are they?
A stroke is essentially, and put simplistically, death of brain cells.
That's pretty dramatic. Let's go into it.
And there are two ways in which this can occur. 85% of times, it's due to blockage in an artery, and we term this ischemic strokes. And about 15% of times, it's due to bleeding in the brain, and we call this a hemorrhagic stroke. So the mechanism of brain injury, and I'm not going to sugarcoat it, brain death is due to either blockage or interruption of flow or through bleeding within the brain.
Right. So one of the things is that it's a common condition seen in Trinidad and Tobago, but really I think a lot of people don't know enough about it, so they don't present in time. So can we talk about the symptoms that they're supposed to identify?
So common symptoms of stroke can include limb weakness. In some instances, it can be arm and leg weaknesses. In some instances, it can be face, arm, and leg. In some patients, they can walk, but there's loss of coordination and balance.
Right, yeah.
And in some patients, loss of the ability to speak, some loss of the ability to understand. A stroke does not affect an individual. A stroke affects a family, and in Trinidad, a community.
Right.
So we have to just really understand that it's not just a stroke. It's a stroke, and there is the burden of stroke.
See, the problem I have is that the patient comes into the emergency room, but they've been with their symptoms for about 12 hours, 24 hours before they come in. And what I would like the general population to know, when they should come in.
The problem is that, and this is not just limited to Trinidad, but this is worldwide, most people respond to a physical symptom such as pain.
Correct.
So you've got a pain, you're more likely to seek medical help than if you don't have pain.
For sure.
If you've got a heart attack, you're going to get chest pain. Most strokes are painless.
Correct.
So we still, in Trinidad and Tobago, hear things that I'm going to try and sleep this off. I'm going to try and power through it and see if my weakness is going to improve. And unfortunately, there is this adage, time is brain. The longer you don't get treatment, more brain cells die and there's more loss of function. So I like to say any deviation from your normal function, whereby there may be loss of limb function or cognitive function, or when in doubt, seek medical care.
Great. I have a controversial topic for the both of you. What are your thoughts on turmeric tea or noonie juice for the treatment of strokes? Zap.
When I do the carotid endarterectomy, they find the vessel is 100% open now, and they go back to him and he puts them on meds. And then they come and they ask me if they could use the noni juice and the turmeric. I said, sure, it works, because I know they wouldn't block the vessel again. So it does work.
It works.
I am not averse to alternative and complementary medicine. It certainly has its roles
In stroke management.
in overall health, well-being, but whenever a patient presents with an acute stroke, we've got to trust modern medicine in those times. And after everything has settled up, then we can explore alternative and complementary medicines.
But really, I agree that we should go with conventional treatment and add the traditional things that they like to use, but not do it instead of our
I think that's the
treatment.
most important thing. You shouldn't do it instead of, it should be in conjunction with. So, you've heard about the symptoms, you've heard about what stroke is. After the break, we're going to come back and tell you about the different preventative factors, the risk factors, and the treatment. So, don't go anywhere. We'll be right back.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
Hit the road, Jack. Don't you come back no more, no more, no more, no more. Hit the road.
Get back to living with our fast-acting syrups for relief.
Hit the road, Jack. And don't you come back no more. Hit the road, Jack. And don't you
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
Welcome back. We were talking about strokes just before the break, and we're now going to touch on what the risk factors are. So, Prof. Dr. Pandey, what are the risk factors for stroke?
We know it's been well documented, published. We know of the typical risk factors: diabetes, hypertension, smoking, which includes cigarette smoking and vaping.
Yes, everyone wants to vape now. It's a trend, but I don't think they realize how much of a risk it carries.
Absolutely. But, we tend to overlook other risk factors such as sleep,
Yes.
stress levels, and we think that when you get a stroke in your 60s, you get a stroke in your 70s, it's because of something you did in your 60s and 70s, and that's wrong. Our strokes, and as Prof would speak about later on with carotid disease, buildup of plaque occurs in your teens, in your 20s, and gone are the days where we go outside and play sports for 2 hours. We are now attached to our devices, our PlayStations, and so on. So what we're seeing is a lot of obesity in young adults in childhood, and that correlates with increased risk factors for diabetes, hypertension, which increases plaque buildup, which increases your risk of stroke. And in Trinidad, we have some people, some patients who spend 3 hours a day in traffic.
Oh, yes.
One
that's
and a
true.
half hours to go, 1.5 hours to come back. And we're not getting over 8 to 10,000 steps in a day, which are modifiable risk factors, not just for stroke, but for overall well-being. So there's no fault of anyone, but some good tips are, if you have an hour for lunch and you have a stairs at work, why not spend 10 minutes walking up and down, get out of work, walk on the street, these sorts of things.
So, Prof, Dr. Pandey had just touched on the fact that carotid disease starts at a young age. So, just for context, the carotids are
Yeah, there are two blood vessels, one on each side, the right carotid and the left carotid. There are four of them, but the two major blood vessels are the carotids. They take blood to the brain, and the disease we deal with surgically, times when you get narrowing of the carotids in the neck. Now, they can narrow all the way up,
Yep.
but the ones we deal with surgically, which in fact is the commonest site, is just about here in the neck. And the plaque builds up, I liken it onto rusting on the inside of a pipe. If you look at the outside of the pipe, it looks good, but there's rust progressively laid down on the inside. It's not as simple as that. It's a metabolic process rather than a passive.
Yeah.
But as Dr. Pandey said, it starts very early on, and like all of us around this table and everybody in this room here would have plaque. It's just how mild or how severe it is, and how mild or how severe is determined by risk factors as well, apart from just aging. And once somebody reaches the level of getting a blood vessel that's almost blocked, 80% blocked, 70% blocked, it means all their blood vessels, the ones to the heart and the ones to the kidneys and the ones to the lower limb, are all rusty. If your house is 70 years old, all your pipes are 70 years old.
Correct.
So when we see you with carotid disease, we also vigilant about cardiac disease and renal disease and so on. So we don't just jump in and operate on these people.
No.
We have to assess all their other problems.
So let's go into the treatment of strokes. So there's different types of treatment. So maybe we could break it down.
We'll speak about that, and that goes a little bit with what Prof was
Yep.
saying. Whenever we speak about the treatment of stroke, what is more important than the treatment of a stroke is where did that stroke come from?
Correct. Yeah.
Because we have 3 phases when we treat strokes. We have the immediate phase, which is what are we going to do acutely to reverse some degree of cell death. Then we have the stabilization phase, how we are going to address secondary risk factors, stabilize that patient if there is any life-threatening sequelae of the stroke, and then the rehabilitative phase of the stroke. But 25% to 30% of strokes are due to carotid disease that Prof was mentioning. But the largest degree of strokes, about 37%, are what we call small vessel strokes, also known as lacuna strokes. And the number one risk factor for that is hypertension, followed very closely by diabetes.
Yeah.
And then about 20% of strokes are what we call cardioembolic, meaning a problem in the heart whereby a clot has formed in the heart, has gone up that carotid, goes into the brain. And then we have a category known as cryptogenic, whereby we just don't really know. And that's when you have to go into lots of exhaustive testing. So really and truly, our first job, once we've stabilized and put a limit onto the amount of cell death that is occurring, is to then find out where did the stroke come from. And our treatments are tailored based on where the stroke came from. So in as Prof was saying, if there is carotid disease and I don't want to get into, some controversies in how much plaque or how much rust you need, but generally the number is 70. 70% blockage usually mandates some degree of intervention.
Yeah.
If we have plaque buildup within the brain, it's usually in the form of medications such as blood thinners, as well as control of diabetes and hypertension.
You mean the treatment?
That's correct.
Right.
And if there are plaque, if there are clots coming from the lung, a bit from the heart, a bit more aggressive blood thinners. So the cornerstone of treatment really is the implementation of appropriate blood thinners, as well as control of your secondary risk factors. And when surgically necessary, it's really a team approach where we work with the radiologists, the vascular surgeons, and the neurologists to determine if these patients would require some sort of intervention.
Prof, I have a question. Could you talk us through a carotid endarterectomy or a surgery for carotid disease?
Okay. Before we go through that, it's endarterectomy means it's like you have a blocked pipe. I cut the pipe open longitudinally, look inside the pipe, and remove a cylindrical chunk of muck out of it,
Muck.
and then restore continuity. That muck looks like a cheesy kind of material, but it may be calcified and be hard, but it's a yellowish material, like, I don't want to say cholesterol, it's a mixed bag of stuff, but it's fatty stuff.
Right. And do you get it all out in one scoop?
Oh.
Scoop? Or do you have to take it out in pieces?
No, we have an instrument that dissects it off the lining, and we get a nice chunk to give the patient, like a mini hot dog.
You give it to them?
Oh, yes. I tell them it's not for eating, but it's for looking at. Because it's quite small, of course. A carotid is a small vessel.
Right.
But it comes as a nice, organized cylinder of junk.
How many patients take it home with them?
I think all of them.
No.
Because I put it in a preservative and I tell them it lasts 100 years. And if after that it deteriorates, we'll take out the other carotid plaque for them. But it never came back.
Never, huh?
Yeah.
Okay. So,
And by the way, we do some of them under local, like if the patient has cardiac risk. In fact, the first 150 we did was under local anesthesia. So we don't even need to put them to sleep. We just inject here, get it numb, go in, fix it with the patient awake and talking. Yeah, Avidesh, you want to mention about the use of thrombolysis and when it should be done?
oh, Prof, wait. We have a quick break to go to first, so don't go anywhere. When we come back, we'll be telling you about the emergency treatment of strokes.
So here are some tips for taking care of your feet. Prevent serious foot complications by preventing trauma. Trauma means avoiding high risk things like gardening barefooted, walking in the yard barefooted. And when you get an injury, you should seek attention immediately. Avoid the home remedies, the candle wax and the various leaves and the herbal remedies. See a specialist urgently. Look for cuts, redness, swelling, blisters, ulcers, and so on. Have somebody inspect your feet if possible, because you may not be able to see very well. Wash your feet, keep clean, dry it properly, and cream so that you would have it moist. Better have somebody do it for you so that they can notice any abnormality.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
Did you know in 2020, about 2.3 million women were diagnosed with breast cancer worldwide, and 685 women died from breast cancer? Therefore, every 14 seconds, somewhere in the world, a woman is diagnosed with breast cancer. This is why early detection of breast cancer offers the best chance to treat this disease. One of the most effective ways to screen for breast cancer is mammography. If you are over the age of 40 or have a family history of breast cancer, you want to schedule your mammogram yearly. It is important that you do not put off screening for fear of pain or discomfort. A mammogram should never be painful. To reduce this discomfort, try to schedule your exam after your monthly period when breast tissue is less sensitive. It is also important to do regular breast self-examinations at home. If you notice a change in your breast, such as a swelling, a lump, skin irritation, or dimpling, talk to your healthcare provider. If you have family members who have had breast cancer, especially a mother or sister, tell your doctor, as your own risk of cancer may be higher than average.
Welcome back. So before you went on break, we were talking about the emergencies and treatment of a stroke in an emergency. And as an emergency room doctor, we know that there is a limited amount of time and we have to act fast, especially in the acute phase of a stroke. So Dr. Pandey, let's talk through how the treatment is managed, how we work up patients and what we do for them.
This is where time is brain.
Yep.
From the time that patient presents to the emergency room with some degree of neurological impairment, brain cells are dying. Our job is to limit the amount of brain cells that die,
Right.
and that is related to blood flow in the brain. So, if you have within 4.5 hours, and I want you to remember that,
It's the golden window.
that's that golden window.
Right.
That is that time. Every patient in Trinidad, every patient should know that once you've got a neurological symptom, you have 4.5 hours in which to get in, get scanned, get treated.
Correct.
And that treatment that we usually go to is called thrombolysis. That's a very powerful blood clot remover that is administered intravenously. Now, in order to be a candidate for that, we have to look at a scan, a CT
Yes.
scan, and to see if there is bleeding. Because if there is bleeding, we can't go and thin the blood because you get more bleeding. But remember, I told you 85% of patients are going to be due to a clot.
Correct.
Now, in general, 1% of patients, that's 1 in 100, are usually candidates for thrombolysis.
1 in 100. That's quite a significant statistic.
It is. And that's why, as an emergency room physician, you have to act quickly.
Correct.
And you have to get them scanned quickly, and a critical decision needs to be made. And that usually involves us speaking with relatives because no procedure is without side effects.
Of course not.
So that's usually what we call, as Prof alluded to, intravenous thrombolysis. And in certain centers, you can even go further, whereby up to 24 hours after the onset of a stroke, depending on your CT scan, the presentation of symptoms, you can do a mechanical procedure where you make an insertion either through the wrist or the groin, insert a catheter, pass the carotid, get into the brain, and remove that
Retrieve
clot.
the clot, yeah.
So that is not as common,
No.
but the very important first step is to be assessed, scanned, and then determine if you're a candidate for whichever procedure.
And this is why I am so particular with my emergency team to make sure that they act fast. We can't afford, like you said, time is brain, so we cannot afford to lose time.
Yes.
Yeah, because if even we can restore the circulation, say 6 hours later, those brain cells at risk have already died.
Correct. And
So we have irreversible changes.
Yep. And the damage then can't be fixed. And that's why you have people with deficits, such as the limb weakness, speech impairment.
One of the ways that I like to look at it is that suppose your brain is a 3-storied house
That's an interesting concept. Let me hear this.
and you've got that vasa main coming into the house. That's your carotid artery. And a clot breaks off from there. And it goes up to the 3rd story. At least your 1st and 2nd story is okay. But what if you have blockages everywhere and that blockage is allowed to proliferate more rooms and more floors are going to get damaged. So you have to assume time is 0 when they come in, get scanned, and you want to limit the amount of floors, the amount of rooms that are going to go without water, or in our instance, circulation.
Correct. That's very true. Now, we've talked about the treatments. We touched on the preventative factors. So when a patient comes in who is not eligible for thrombolysis, they often come in and they get treatment with the blood thinners that we talked about, and they're worked up with ultrasound scans and CT scans. You tend to see some of these patients that have the carotid disease that we touched on before. What proportion of patients are eligible for the carotid surgery that we discussed?
I can give you a little bit of an answer, but I would defer, meaning that 25 to 30% of all strokes are going to be due to carotid disease, but not 100% of those patients are going to benefit from carotid surgery.
Right.
So generally speaking, if you've got significant blockage, but all 3 stories are already damaged, there's probably not much point. But I'll defer to Prof on this one.
Yeah, like he says, there are wide variations. For example, very few people come with, say, a 70 or 80% narrowing here and a quite clean carotid here. No.
Right.
It's because both blood vessels are the same age and they carry the same rusty water for a long time. So we usually dealing with bilateral disease. So the first decision to make is which side to operate on. Of course, we operate on the symptomatic side first as a general rule. And the other thing is the percentage severe enough to explain the symptoms that the patient has? So it's not just because there's a narrowing, we're going to fix it. It has to be a narrowing that is sufficiently severe to explain the symptoms that the patient has.
Right. So there has to be a cause and a reason for why you're going through
Yeah,
this.
you don't just go in on everyone.
Right.
And then those that are completely blocked, it means that the brain cells that are going to suffer are now already dead.
Right.
We do not go and fix a completely blocked vessel, except in very unusual circumstances. So a complete block, we hardly ever touch. So there are many considerations. It's not just because there's carotid disease we're going to operate now.
Okay. So this one's for you, Dr. Pandey. A lot of the times patients come in to the emergency room. They have the symptoms of the stroke, but these would resolve within 24 hours. So this is often termed as a mini stroke or a TIA, which is a transient ischemic attack. What is your view on TIAs versus strokes?
TIAs, well, strokes is an all-encompassing term. You've got minor stroke, you've got major stroke, you've got TIAs. A stroke is a stroke.
Right.
And in many instances, one of your big risk factors for having a stroke is previously having a stroke.
Which is the TIA.
Or you can actually have, as we spoke about, lacuna events, different types of events. So we must treat all strokes very seriously, and we must do that full diagnostic workup as to minimize any possible risk of having another stroke. Because the more strokes you have, is the more disability you're going to get.
Correct.
And I think that most patients do get that.
Right. Thank you very much. Unfortunately, that's all we have time for today. So I have to thank both of you for coming in. We really appreciate it. As usual, if you have any questions about the episode, feel free to contact us on our social media pages and look out for us next time for our next episode.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.